First of all, I want to recognize that if you're in a larger area, larger city, or larger town, it's likely that you have some terrific specialists in your community. I think of where we are in Phoenix. We have some really brilliant specialists in every degree of specialty. Now, that may not be true if you're in a small town or if you're remote. And specialists are such a wonderful component of our profession. So I don't want to take anything away from our specialists at all. They're a very welcome component. And what I teach my clients to do is be very selective about their specialists. And in some cases, it might mean picking one from each specialty that you work with. You have one oral surgeon that you work with, one periodontist that you work with, you have one endodontist that you work with, you have one pediatric practice you work with, and so on. As opposed to what I sometimes see, which I think is a wrong minded approach, and that's that you pull out 5 business cards for oral surgeon in your area and say, here, pick one. No, I think you should do the screening for your patients. Pick the oral surgeon that you believe in, that you believe in not only the quality of the clinical care, but the way they treat your patients. Because when you send a patient there, they in essence become an extension of you. That referral can be either a fabulous experience where the patient is very grateful for the referral, or Naren, it could be egg on your face. Absolutely.
Great, Gary. I think this is a very personal decision, but I do think that passion, at the end of the day, what do you enjoy? How do you want to spend your time should be the driving factor. And as your perspective on, that those questions change, like I know of a situation where this particular doctor had some challenges with his son and in his breathing, and and he went into that direction and he became an expert and he started teaching and he became like a world authority in that whole space. So it can lead you anywhere. I think there's no right or wrong answer. You have to just let your passion lead you, so to speak. And I guess
one of the dynamics that I've noticed when you refer, if you are going to refer, let's say you make a decision that is something I really like a specialist to do. You have to recognize the reality of some patients won't go. They won't go to the referral source,
right?
And I think one of the reasons is they have come to know, like, and trust you and your team, and now they don't want to roll the dice, even though you're recommending it. They don't want to roll the dice and take the risk that it might not be the same kind of experience they have in your practice. Every client I know has patients that we've referred and they don't go. And when we press them on that, when we ask them about it, they will typically say, well, if you can't do it, doc, I'm just not going to have it done. And that's something else that's very pragmatic and very practical. And now there may be cases where you're not going to do that service. Then you have to, then that patient really, we need to guide them into a specialist, and that all the more reason to have a tight relationship with the specialist, so you can assure them that they'll be well taken care of over there, and not just a random specialist, for sure. But back to the general question, super GP or staying in your lane. They're not mutually exclusive. I actually think you can do both very well. And if you're the kind of person that likes the diversity of services, that's great. When obviously we call this podcast The Thriving Dentist Show, and I'm asked, what does it mean to have a thriving practice? And I'm going to give you that definition right now. It's a practice that provides personal, professional, and financial satisfaction. Personal satisfaction means you're taking care of patients you enjoy, surrounded by a team you love. Professional satisfaction means you're doing more of the kind of dentistry that you really enjoy doing. Whatever it is that, whatever flavor that is, you're doing more of that. And number 3, financial satisfaction, a little more self-explanatory. You're being rewarded handsomely for your care, skill, and judgment, which kind of leads me to the wrap up to this coaching and action segment. I personally think a great model is to have an expanded function, expanded services, general practice where you do most services in your practice, but you also add selected high-value services. Selected high-value services. High-value services are those things like, say, placing restoring implants, adult orthodontics, cosmetic dentistry, maybe OSA diagnosing and treating obstructive sleep apnea with appliance therapy, maybe complex restorative dentistry. Again, assuming those are things you're interested in. Maybe it's doing something that's more on the super GP side, which would be using oral conscious sedation for certain patients. But I think that's a great model that kind of falls in line with both of those definitions of super GP and staying in your lane. Stay in your lane on those high value services that are either complicated clinically and perhaps even medically, clinically. You think of the implant cases. You want to be very selective about your implant cases so you're not dealing with the medical complications that might really affect an outcome that is somewhat outside of your control.